Hello, I'm Matthew Balti with the Acoustic Neuroma Association. I'd like to welcome everyone to the 2024 ANAwareness Week presentation of how to be a great patient with Dr. Ravi Samy of Lehigh Valley Health and Emily Praeter. You can stay up to date with ANAwareness Week and everything the ANA has to offer at anausa.org. Our website is a great resource for so many topics you may have an interest in. There is a search function so patients can find just what they're looking for. Lastly, keep an eye on our social media pages, Facebook, LinkedIn, Instagram, and Twitter for more information and resources. The ANA is here to help, so please access those opportunities. So Dr. Samy and Emily, if you'd like to introduce yourselves, we can get started.
Thank you, Matt. Appreciate it. If it's okay with you, I will share a screen. Can everyone see that?
Yes, we can.
Wonderful. Thank you so much for the introduction, and it's a pleasure and honor to be a part of the ANA. It's an outstanding institution, or it's an outstanding organization, I should say. And Mrs. Prater and I have known her for a few years now. And I've wanted to do this webinar for a long time because it is important. You know, we all talk about having a great healthcare system, great physicians, great nurses, but to have the best outcomes possible, it is so important for patients to be great and follow the recommendations of their healers, of their physicians and nurses. And I also think in the midst of all this, being grateful, right? As Mrs. Prater would say to a lot of people that she's talked to, thank God this is not a glioblastoma. I'm happy that this is not a malignant brain tumor. So thanks for allowing us to do this webinar. And hopefully it's very beneficial. Our emails are here, so please reach out to us if you have any questions. So I'm going to go on to this picture first and have Emily show the important things in her life.
Yeah, so that's me, second from the end, next to my husband, our triplets and our 23-year-old. So I hopefully am on this webinar because I'm the good patient. So I'm not really sure if that's the case or not, but just in case it is, and I'd like to preface it with that. But I was a patient actually of Dr. Samy's, and I am about 6 years post-op, 6.5 years post-diagnosis. So I've worked with lots of patients through the Acoustic Neuroma Association, but also through University of Cincinnati and through Lehigh Valley Health Network. So I've been lucky enough to talk to patients across the country and kind of walk their journey with them. So I think I have an interesting perspective in where I was a patient, and I get to hear the doc's side of things, but I also get to hear from a lot of patients who have done different treatments and kind of worked with different institutions and had different outcomes.
Thank you. And you are an outstanding patient, and I think you're perfect for this because I think having trust and rapport between physician and patient is always so important because we are a team. We do this together because this is a challenging time in a patient's life. And for me, this is my main job. Here I am with my wife and my twin daughters and our twin Belgian Malinois pups, who at that time, by the way, they're probably like 6-8 weeks old, but they actually shared a birth date with my twin daughters. And to dads of little girls, they always think of this is what the girls look like, but my girls are no longer little and they're now young ladies. So it's time has gone by fast. So this is my main job. My second job is as a physician, and I've been blessed to do this for almost 25 years and have been doing neurotology, skull-based surgery with a passion for taking care of patients who have skull-based tumors. But if you wonder why, as a physician, I'm talking to you about how to be a great patient, we physicians also get sick, right? So as a kid, I had asthma and allergies, a lot of different illnesses as a child, and the treatments for those things got much better as the years went on. But unfortunately, 4 years ago when I was 50, I had a great primary care physician who said, "You're 50. I need you to do all the things 50-year-olds do, such as I need you to make sure you get a colonoscopy and let's get your PSA checked." And lo and behold, my PSA was pretty significantly elevated. And repeat PSA showed it climbed even higher. Tried antibiotics, didn't get better, right? So some of those things remind me of patients who have hearing loss, didn't know they had an acoustic neuroma. They thought, oh, I just have wax in my ear. You don't think much of it at first. I didn't think much of it at first. I thought I just must have prostatitis, something not a big deal. And then I get an MRI scan. So like patients that get MRI scan for their hearing loss, my MRI did not look good. And so then got biopsies, showed prostate cancer. So 4 years ago, I had a robotic prostatectomy. And so here I am 4 years later. I'm doing well, but it really changed my life as patients with acoustic neuromas. It changes their lives. And so the joke is we doctors and nurses don't make the best patients, but I really worked hard to try to be a good patient for my physician, my surgeon. So I understand what it's like to see both sides. So I was trying to figure out with some of these things, how do we get patients to understand the process? And I would say, and this is from the EU, and at the very bottom, you shall see the where you can find this on the web, but it's the idea of patient empowerment. And I like this paragraph they have written here. Patient empowerment is a process that helps people gain control over their own lives and increases their capacity to act on issues that they themselves define as important. So what's important to you? And you need to let me know that. So if Emily tells me, hey, my kids are important and I want to be able to do X, Y, or Z with them, that give and take and what she wants out of it is incredibly important. But aspects of empowerment include self-efficacy, self-awareness, confidence, coping skills, and health literacy. While I think it's important for patients to be able to look at things on the electronic medical record, I really would rather have a patient say, hey, Dr. Samy, why did you put me on steroids? Why this dosage? Those are the kinds of things. And I think Emily had that in spades. She was phenomenal about asking questions, was always respectful, and never had problems with her asking any of the questions. She and her husband were lovely to talk to and work with. Emily, you want to take this slide?
Sure. This is pretty important to me. My journey included lots of visits where I begged a doctor to understand that I knew something was wrong with me. And I just kind of felt like I personally lost my voice because I didn't follow up as much as I should to get the right answers. I think that's something as a patient that you can do, obviously pre-diagnosis, during your diagnosis. Kind of the slide before Dr. Samy was talking about being empowered to help make the right decisions in your care. So that this goes right along with it, is that you don't want to lose your voice in your care. You keep asking questions. Interestingly enough, I think we'll touch on this later, but if you have someone to go with you to the appointments, having a family member help to write down questions, ask questions, or hear the answers, because sometimes when we leave, it's hard to remember everything that we've been told by a doctor. I do think that it is important almost immediately in your journey that you include the ANA. It's so many resources and so many people that have already been there. So I think those are just important things to touch on this slide.
And at the bottom, I added on because I think part of this I look as a patient with my history of prostate cancer, but part of this I look as a physician and a surgeon. Your physician should help provide clear and concise information, but I will tell you, it's hard. We have a shortage of physicians in this country, and there's always more patients to be seen, and I feel bad. I would love to spend as much time as each patient wants, but some days I have add-ons. I was running late to this meeting today, in fact, for this recording, just because clinically ran over. So even if you can't get all your questions answered at that point in time, I think it's an ongoing discussion. Epic My Chart is fantastic. You can reach out to your physician that way. I have all my patients receive my email, and they can reach out to me that way. But then I also have a fellow, I have a PA, there may be residents depending on where you are. And so reaching out to them as well. But don't hesitate to ask questions over and over. And sometimes you need more than one meeting. And Emily said this to me, and I've never forgotten this. And this probably goes along with what I dealt with as well. She said once she heard the word brain tumor, she kind of shut off. And she says she feels like a lot of patients feel that way, that they don't understand or they don't think anymore clearly because the emotional aspect, because we're all human. And I would argue for my prostate cancer, I think when I knew it was a cancer, I think it just completely threw me off. And so having someone else be there to help you and be your support is so important. Self-care, incredibly important. Taking charge of your health, improving your well-being, set goals and targets with your physicians. Some of my patients, when I come in, I will say, as much as you may want surgery for this, maybe right now, surgery is not the right thing. Maybe for right now, we just observe this. I also think observation gives patients time to absorb what's going on. Conversely, Emily, correct me if I'm wrong, I think you've told me for some patients, the observation period for them is almost nerve-wracking, and they get a lot of anxiety and stress with that.
Yeah, we call it the mental toll of waiting, in that if you are already feeling anxious and the anxiety of waiting, if you believe the outcome is not going to change at home or your situation by waiting, sometimes it is harder to wait than to jump right in.
Yeah. I noticed I had a gentleman with NF2 today, and NF2, for those of you that don't know, bilateral acoustic neuromas, it's very challenging. It's hard enough to have one acoustic neuroma. I can't imagine dealing with two acoustic neuromas. And I could tell he was overwhelmed with the amount of information I was providing him. And I said to him, he had not been part of the ANA before. And so I gave him resources for the ANA. And I also said to him, I said, let's just focus on one thing right now. Even though I told you all these different things and it's on your Epic chart, you can actually look at yourself. I said, let's focus on step one first. And I think that allowed him, he's going to work on balance with a balanced physical therapist. His wife is worried about him being a fall risk. So if you take it one step at a time, I think sometimes, and as we as physicians, it's sometimes we do this, we'll give you 5 to 10 things to think about and you're overwhelmed. You can't comprehend how to do all that. And just saying, Doc, what's the next thing? What's the one thing you want me to focus on? Keep it simple. That's very important.
Dr. Samy, we actually had a question that I think goes well with that slide. Somebody was wondering, is there any particular diet or eating plan that may be helpful in aiding to a quicker recovery and better surgical outcome?
Oh, that's a great question. It's funny, isn't it? Every time I open up Apple News or anything, it says this is the new diet that's the best. Intermittent fasting, paleo, keto, you name it. I would say make sure whatever you're doing that you're walking that with your primary care clinician as an example. Because what may be good for a diabetic may be bad for someone else. And so there isn't any one thing, but I will tell you, so I love some of the apps that are out there that allow you to do tracking of your food intake, tracking of your steps. There's so many resources that are available free now on your iPhone or your smartphone. So I'm not going to say any one thing in particular, but I think we in America, it's unfortunately a highly processed diet we often have. More fruits, more vegetables, drinking more water, less Diet Coke, less caffeinated beverages. Those are things. I have some patients where I'll say to them, listen, you have diabetes. It sounds like you've never met with a nutritionist before. Let's get you to see a diabetic nutritionist. I think getting patients the tools that they need will help them on the front end, rehab, as we'll talk about again later, and then help them with the recovery. So that's a great question. And things like diabetes, as an example, diabetes, if it's not well controlled, will increase your risk of the wound not healing well, increase your risk of a wound infection and wound breakdown. For this slide, one of the things is self-monitoring is important. I have a lot of patients who come in and I'll ask them, what medications are you on? And they'll say, it's in Epic, it's in the chart. And I'll say, I know I can look at that, but I'm curious, what do you think you're on and why? And basic, simple things like saying, hey, I'm on a atenolol and I'm taking that for high blood pressure. Just knowing that allows you to be smarter to understand. So, for example, you may say high blood pressure. What does that have to do with an acoustic neuroma? Well, I've had patients whose blood pressure is in the 170, 180 over 100 range. And I'll say to them, I can't operate on you yet. Because God forbid, during surgery, your blood pressure shoots up, increases bleeding problems for us as surgeons, but then uncontrolled high blood pressure can cause long-term heart attack risk, stroke risk, kidney failure. And then working, as alluding to what Matt had said, work with your physician on a personalized plan. What works for you? How do you help yourself be healthy? What's really neat is, I will tell you, and Emily, I'm curious, with your interaction with so many patients from across the country, I'm impressed by the number of patients I've seen that have used their acoustic neuroma to take charge of their health and their lives. And it's really cool to see someone who now their diabetes is under good control, their blood pressure is under good control. It's really neat.
I agree with you completely. I mean, I do think that there are times where a diagnosis, a big diagnosis such as this, is, somewhat of a wake-up call for us. And so, I mean, I gotta be honest, my treadmill got a lot more work so
That's funny. Just that it didn't just hold clothes then. It didn't just hold laundry. Yeah.
correct. It's doing its job these days.
That's funny. And this is a website, by the way, like I think all the resources are found around the web are free. AHRQ, which is a governmental agency, talked about different things for health literacy. It's very important for us to help educate patients of different socioeconomic status, educational level, helping patients do the best job regardless of where they live, if they're in an area with more challenging healthcare resources. I think the web and all these resources are phenomenal. All right, I'll have Emily take this one.
Oh, this is near and dear to my heart. So interestingly enough, I mentioned earlier that I had an almost 4-year journey of coming to a diagnosis of what was going on in my world. And so it got to the point where I believe visit number 4 or 5 to my primary care physician, I had Googled everything that I thought that I mixed up my symptoms, put them in different order, but interestingly enough, Google was correct. I did have a brain tumor. So, but with that said, we're all patients. As soon as you get a diagnosis, you probably aren't even in the car yet and you're hitting Google and typing in everything you can find about the diagnosis. But as the slide says, it really is a double-edged sword. You hit the reliable sources like the Acoustic Neuroma Association, but there are lots of sites and information out there that wouldn't particularly pertain to every patient. We're all unique, obviously. So it's for sure a double-edged sword. I think the next slide hits on it as well, is that when you do find the information online, the loudest voice isn't always the most reasonable. You get into some of the patient forums and there's a wealth of knowledge and you just have to use a filter. You have to filter out what would apply to you, what wouldn't, and also realize that some of us like to discuss very specific things about when we were a patient or about our diagnosis or what happened during ours. And fortunately for all of us is that we are 100% unique in our diagnosis. I have yet to mentor a patient that exactly resembles somebody else. So it's always interesting.
Well said. You're spot on. I agree with you. This is important to me. I think what's fascinating is the number of patients over the years that I've seen that maybe they have a bad headache, and acoustics typically don't cause significant headaches until they get to a decent size. And so maybe the primary care physician or maybe the ER has a patient who has a headache, so they get a CT scan or they have an MRI scan. And I'm shocked by the number of patients, especially if they come through the ER, that will have an acoustic neuroma and they'll have access to me because of that, but they don't have a primary care physician. And I will tell you, I think that is one of the best ways, going back to one of the earlier slides about empowering your health. I was very fortunate. My primary care physician, I had known him since I first started my prior academic position, and he's about my age. I'd known him for, 12, 15 years. And I trusted him. He knew me. I knew him. And so having a good primary care physician, that continuity of care, I can't stress that enough. And then for patients in whom are overwhelmed by things like Epic MyChart can be overwhelming. I'm very happy. It's a good way for patients to be able to see results, their MRI results, their visit results, after visit summary. Some of my patients get overwhelmed by that, especially some of my older patients who are not as tech savvy. I've had some of the most organized people who come in, they have a binder, and literally they'll say, oh, this is my neurotology physician section. This is my audiology physician section. This is my neurosurgery, my radiation oncologist. It's really neat to see. And that may be a good way just to help yourself stay organized. I don't have a problem at all with urgent care. I think urgent care can be really important for urgent issues, but it's not a substitute for proactive primary care. So if you use that urgent care, try not to use that regularly for taking care of healthcare issues such as diabetes or high blood pressure or high blood cholesterol. So this is just my feeling. I don't know if everyone necessarily in the medical community feels this way, but even if I have patients who see a primary care clinician every 1 to 2 years, I don't think that's unreasonable at all for routine health checkups.
Dr. Samy, I actually have another question with that one that I think
Please.
would fit very well. I think one of the reasons sometimes people may not have those great relationships with their primary care is they might seem a little intimidated. They might feel that their questions may seem foolish or might be a stupid question, for lack of a better term. So how would you suggest somebody might bring up any concerns they may have, either with their primary care physician or their neurosurgeon, for any concerns they may have without sounding foolish?
Yeah, I think it's wrong. That's on us as a medical community. There should be no such thing as a stupid question. And this gets back to what Emily said earlier. Don't lose your voice. This is your health. And if you're feeling like that trust factor, we'll talk about that in a little bit. I teach residents and fellows, have been doing this for a long time, and I'll say to my residents and fellows, patients don't necessarily know how much you care. It's that old line that they want to know, or they don't care how much you know. It's more how much do you care? And is there trust and rapport? Is that doctor looking at me directly in the eyes? And if you don't get that sense, I don't think getting a second opinion from another primary care doctor, because I'll ask some of my patients, I'll say, hey, what do you think about your primary care doctor? Have you had your health checked in a while? Some of them will say, I don't really like that primary care doctor. I don't feel like we collect. And I said, that's okay then. Find another person. I do think primary care, this is a great paragraph. If you don't mind, Matt, I'm going to read this. It's the importance of primary care to the U.S. healthcare system. Evidence of the health promoting influence of primary care has been accumulating ever since researchers have been able to distinguish primary care from other aspects of the health services delivery system. This evidence shows that primary care helps prevent illness and death, regardless of whether the care is characterized by supply of primary care physician, a relationship with the source of primary care, or the receipt of important features of primary care. The evidence also shows that primary care, in contrast to specialty care, is associated with a more equitable distribution of health and population, a finding that holds in both cross-national and within national studies. The means by which primary care improves health care have been identified, thus suggesting ways to improve overall health and reduce differences in health across major population subgroups. Bottom line is this helps prevent illness and death. If there's one takeaway, right? We want you with an acoustic neuroma to have a long, healthy life, and taking care of the other aspects of your life cannot be overstated. All right, Emily, you want to take this slide?
Sure. Following from the previous slide, I would just like to also add that if your primary care physician or any of your specialty team isn't right there in the front of the line with you, championing with you, you're not in the right place. Because once you have the doctors that are making sure you are getting the answers you need, finding your diagnosis, getting you to this pre-treatment spot, then you might not be at the right place. And unfortunately, I did go through that, right? So it feels different when you land where you need to be. So going into pre-treatment and with the doctors, we're now at a place where we've established trust and we can ask the questions and we can tell the truth. So being honest with your physician in all aspects, whether it be anything listed here, alcohol use, tobacco use, etc., anything about your medical state. And, that's going to include your history, your surgical history. That's going to include where you stand in a mental space. Are you ready for this? Are you equipped to handle, the next steps in your treatment journey? We talk about bringing a family member or an extra set of ears, because as Ravi said, as soon as I, as a patient, heard the words brain tumor, I'm pretty sure the rest of that visit, I heard nothing else. I heard him talking, but I don't think I kept any of the information. So I think this is all really important, that you have that level of trust, that you can discuss, what it's like at home, your family history, your social history, all of the things at home that could add extra challenges in your journey, in your treatment, and in your post-treatment.
And this honesty part is, as a physician, I know we're all human. We all make mistakes. But like I've had patients who have told me about their cocaine use, and I appreciate them telling me that, because if I don't know that, cocaine can be a life-threatening issue at the time of surgery. It can cause heart arrhythmias. It can cause sky-high blood pressure. My goal then is not to judge that patient and say, how dare you use cocaine? And that rapport should be, hey, listen, here's why I don't want you to use cocaine. And I appreciate you being honest and telling me that. Because unfortunately, we've had patients with opioid addiction and other illicit drugs, and it's a hard job for me. Surgery already is hard enough as is. Our anesthesia team is outstanding. They've got to monitor your heart and lungs. They've got to watch your blood pressure. And so this honesty helps us do a better job. And then the standard initial visit, as I wrote down there, is how we go through. It should be a very detailed thing: past medical history, past surgical history, family history, all those things. And Emily, you said this well, there are no two patients you've ever met that are exactly the same, because I could have two people that are about the same age, but one's married, the other's not. I could have one with 5 kids, the other has no kids. I could have one that's working from home and the other's a construction worker. And how I decide to deal with each one of those things is important for me to know. It's part of being very comprehensive and holistic in approach. Prehab, this is important, especially from the surgical standpoint. There are so many people that are often involved with your care, and it can be overwhelming. But as we look at a care continuum and care coordinators, all of these aspects are incredibly important. And then us learning from you, are you going to a safe home, a clean home? Is it going to be a great support system for you? If you're an older patient and you're a widow or widower, who's going to help take care of your home? What about your financial status? I think these are all things that can be hard to address, but the more you let us know. I have a patient who operating on something else today, and they're talking about the finances. And I said, listen, I want you to know exactly how much you're paying. Do not proceed, because I feel bad as a physician, as a caretaker, to have someone then get from hospital a $5,000 or $10,000 out-of-pocket expense. So know all those things. Emily, your take on this slide?
Yeah, I think we touched on it already too, is that, this goes into the building the good rapport and honesty with your physicians. I think we've touched on, are you the only person working in the home? Is there multiple people helping? Are you a caregiver? Do you have anyone with special needs at the home that you are responsible for? Is there, just down to the smallest details? These are things that, I think that sometimes as patients, we are not quick to think of or not quick to mention that this can, somewhat slow down what we need to do at home. So these are all important things to consider and to talk to your care team about.
Yeah, and I think for you, I think you did a good job with this, but your kids were relatively young at that time, and your mom helped, and your husband was there as well. And so, but I think for parents and moms in particular, I'll have to tell them, you are actually the patient for this next month post-op. You're not allowed to focus on your kids, and that can be a really hard role for people to change, but it's incredibly important.
Yeah, Dr. Samy and Emily, what might it mean to have a good standard home or a good home to be in after your surgery? What kind of things do you need to be thinking of? And if you live alone, how long do you need to have a family member or friend plan on being with you post surgery?
Emily, you want to tell me your thoughts on this, and I can add my thoughts as
Sure.
well.
Mine might sound a little different than Dr. Sami's, but coming home, for me, I had young children and a lot of children in the home. But there needs to be a place where there's an ability to have some type of rest and quiet, obviously. I know this sounds really strange, but if you are the person that takes care of your pets, your dogs or your cats, or I currently live on a farm, that's really different than most patients, but I've seen patients that try to change the litter box and that post surgery. That's probably not the best idea for you to do. Um, for me, something that they talk to you about when you're still in the hospital is, are you going up and down the stairs? Are you trying to access your shower, your bathtub? Do you have help to do those things? Some people don't have a lot of vestibular disturbance after surgery, but for me, I did. My balance issues were worse after surgery. I've seen patients that have absolutely zero, but for me, it was getting help up and down the stairs or getting into the shower, onto the shower chair, things like that. And for me, the time frame, I think that differs for everyone. I'll let Dr. Samy speak to that more. But when I was home the first 2 weeks, I absolutely needed more help than I thought that I would. So, Dr. Samy, I'm sure you have.
Yeah, it's funny, Emily. I remember like you and I think you may have said this to me. I had a lot of patients say, "Oh yeah, doc, I'll be fine. This is not going to be a big deal surgery." 100% of them post-op will say, "Oh my God, this is a lot harder than I thought it was going to be." And underestimating that, never underestimate. Two things that are interesting, Matt, from your question, I will tell you, I've learned so much from my patients over the years. And because I have worked in the healthcare field, I've got a lot of friends who are nurse practitioners and in different roles. And one of my dear friends, she was a nurse and ended up becoming a nurse practitioner. And she worked with an insurance company. And she actually would do site visits with this insurance company. She'd go and spend an hour per visit, would see roughly 6 to 8 patients in a day, because insurance companies realize that the better the patients take care of themselves at home, the better they'll do. She said to me something that's I've never forgotten. She said, "You, meaning me, don't understand that some of the patients you send home to or send to directly to home, you have no idea how dirty the home may be. You have no idea how, some of them have been hoarders, not safe homes, not in a safe neighborhood, not clean homes." Emily brought up living on a farm, but I've had two patients who had wound infections from sleeping with their dogs and cats because they had weird bacteria growing from their wound. And those are the things I've learned the hard way of, oh, wow, you don't know that. I will tell you the other thing that's kind of neat is I do a lot more because of COVID. I do a lot more video visits for patients because especially some of my patients can't drive 2 hours one way easily. They have to get rides. And it's fascinating. I now see patients' homes, which I never did. And it's really interesting to see that glimpse of their home. And do I think it's clean, not clean, things like that. So is it a home for healing? Yes or no? I think one of the questions you had, Matt, is like how long should someone, especially if he or she lives alone, there's no easy and fast answer. If I worry enough about a patient, I don't like to send them home. That's where I think rehab facility is very good, skilled nursing facility. I know patients sometimes balk at that idea. But then I'll say, okay, if you're good enough, you're walking here at the hospital well enough, you're having bowel movements, you're urinating fine, you're eating and drinking okay, maybe just for the first week, just have someone with you. See how you walk on the steps at home. Make sure when you're in the hospital with a physical therapist, you tell them I have a lot of steps. I've had some patients, I don't remember for you in your house, Emily, I've had some patients where I'll say, just stay on the first floor, maybe for the first week, even if your bedroom's on the second floor, maybe that first week you're on the couch, and then maybe by the second week. So each person's unique, each person's different, and that's where that communication back and forth between physician and patient is so important. So part of being a good patient, healthy diet. Matt, you talked about that earlier, asked that question. Kids, consider seeing a nutritionist. Get yourself ready for surgery. What is your blood pressure? You can get a blood pressure cuff from Walgreens, CVS, Amazon. It's probably $20. What is your body mass index? So body mass index is just a number to me, just like blood pressure is just a number. And the reason this is important is the higher the body mass index, potentially the greater chance of having diabetes, high blood pressure, high blood cholesterol, sleep apnea. So just knowing this number is incredibly important. It's not the end all be all, but I think it gives patients a glimpse. So I worry more about a patient whose BMI is 35 than one whose BMI is 27, because a BMI 35 most likely has a higher chance of all those other illnesses we talked about. I've had a few patients in my career now whose BMI has been the 55 to 60 range. You may not notice, but when you have a body mass index that high, it makes it harder for us as physicians and surgeons to position you on the operating room table. It's harder to get the breathing tube down. You can do surgery and still have good results, but I've had a few patients who are actually recommended they see a bariatrician and consider some of the bariatric medicines, like the GLP-1 agonists, like Wegovy or Ozempic. I've had patients, actually a couple who've undergone gastric sleeve surgeries and reduced their BMI from the 45 to 50 range to the mid 30s. And so now that's actually helped their overall health and made the surgery much easier on them, as well as on the anesthesia team, as well as the surgeon. I'm a big proponent of exercise. All the studies show the exercise is phenomenal. Everything from a mood elevator to BMI reduction, blood pressure reduction, blood sugar reduction. And I try to get patients to exercise. I'll say to my patients, hey, try to do an exercise an hour a day. And an hour a day is not a magic number, but it's just something that may help your body be ready for something very strenuous. Putting yourself to sleep or getting the anesthesiologist put you to sleep and being on the operating room table for hours is a big, big stress on the body. So it can take a physical toll on you. Emily, your thoughts on this slide, as well as Matt from pamphlets or videos from the ANA. Are there things that the ANA has as resources for patients watching this?
Yes, absolutely. The ANA, because we were a patient-founded organization and we have a team of volunteers who are all AN patients and families of AN patients, there are many resources that can be found through our website, anausa.org, but we have pamphlets and booklets for newly diagnosed patients, and then for a lot of the major symptoms as well. So we have pamphlets specifically for balance issues or hearing issues and headaches and things like that. And then we have a variety of webinars that we've done, just like this one, with all of our sponsor partners. That's just a great place for patients to start, as well as support groups and peer mentors.
Thank you. What do you think about this, Emily?
So we touched on this before, is that this mental toughness, tenacity, the waiting can be hard. It's a mental toll. And some patients know for years, right? We've talked to patients that, hey, I was diagnosed a decade ago. I've been fine until there's these changes. The one thing that I will say is that I've seen patients that are diagnosed, and within a week of diagnosis, I'm talking to them because I've been connected to them by the ANA, and they're not sleeping. They're not doing their normal routine any longer because this is tough. The news has hit them, and they can't get past just the diagnosis. They want to move on towards surgery or gamma knife or whatever's next for them, so that they can put this part of the journey behind them. So I feel like if that is something that whatever patient is watching this is feeling, that's something you want to be really, really honest with your providers, because typically the anxiety in that doesn't usually just go away on its own. You need to talk to your provider, talk to someone from ANA, let them pair you up with somebody to go through this journey with you. I do think something that we always look at also is this positive outlook, how important it is that the positivity goes so far in this journey, and that, we do see a huge difference in the patients that we work with, that, they feel like they've been given this sentence that is almost not able to be overcome. And in fact, like we talked about earlier, I try and talk to all the patients and say, listen, it doesn't feel like it right now, but we are indeed some of the lucky ones. So,
Yeah.
Dr. Samy, if you want to go into the last part of the slide.
Yeah, I think you said this when we were talking about doing this webinar. I think you hit the nail on the head. You said telling people that you've been through this and look at how well you're doing now. Doesn't mean you don't have issues or concerns, but you are still having a wonderful family life. You're still able to do a lot of great things, and letting patients know that there's life before an acoustic neuroma, there's life after an acoustic neuroma. And I think it sets a tone for them to understand, okay, I can do this, and that they're not alone. The ANA and then the individual mentors and support are wonderful for this.
Agreed.
Day of surgery. This is another good one for you.
Day of surgery. So for us patients, it goes pretty fast. So
It does.
once we're asleep, but it is a lot for your family and friends. It is, and for each one of us, this is probably a question I'm asked often: is how long is it? How long is it really? It is different for all of us, right? Dr. Samy can speak to that. We are all extremely unique. Our tumors are unique. Some of them kind of come out easily. Some take a lot longer, hours and hours, as he will tell you. So I try to tell patients and their families, eat, drink, spend the time at the hospital with each other, but realize that if you've surpassed the 4-hour mark or the 5-hour mark that you were given, that's not necessarily bad in any way. It just means you look a little different once they get in there than you looked on paper or in scans. I just always prepare the patients that, if we have been in an operating room for 9, 10, 11 hours, we probably don't look our best when you finally get to see us. So I think that was a surprise for my family.
Yeah.
Is that, you have your dressing on your head. You've just woken up from a very long nap that felt like nothing. They're tired, they're exhausted, they're emotional. So it's a very long day. But the good support system and just knowing what to expect the day of your treatment and day of surgery is important. I did do this with my family, is that I made a list of questions that when they got to see my providers, since I knew that when I would see them in recovery, there was probably very little chance that I would obtain that information for the next day when I was asking more questions of my family. But, write out a list of questions. Each one of us is different, right? Is there some of the approaches that we go into surgery, there is a chance of preserving hearing? Write out the question. If we preserve hearing, what does that look like? If we did not, I like to know right off the bat also. But just all of the questions: was the entire tumor taken? Was it close to the facial nerve? Just all of the questions that I think that you do your research. It's nice for your family to be equipped with that information, and maybe a spokesperson for the group, because if you have a large group like I did, because I have a very overzealous family, maybe one person gets to speak to the physicians over the entire group speaking.
Yeah. And you asked me about the last one. We were talking about this. I've never had a problem with patients recording, but I know some of my colleagues, some of my fellow physicians, it makes them feel uncomfortable. So please just make sure you let the physician know or ask if it's okay. That's a good overview with this slide. Peer mentor list. I think we've hit on this as well. Both Matt and Emily, thoughts on this?
Yes. If you are still in this part of the journey and you have been matched with somebody to talk to and ask questions, or multiple people, because it is really nice to get the perspective from multiple people. Make sure you hit on all those things. What are the questions I should ask? What should I pack for the hospital? What's the best items to have? I think Matthew will tell you, and has actually some resources out there. I think one of our previous patients, and I think she's also possibly a peer mentor or group leader, has made a packing list for you. You don't need to reinvent the wheel. Those are resources immediately available.
That's
Yes,
great.
we do. We have a couple of different PDFs of some of the more smaller practical things that sometimes you don't think about as you're trying to find good support groups and peer mentors, but like that packing list and other things that we come up with both in office, but also we rely on the AN patients that are part of our organization to think of these things for us. You do a great job with that as well.
So talking to your employer, I get a lot of questions about this. Once again, be honest. I've had patients who are pilots, and I'll say to them, you need to this is before treatment. I said, you have an acoustic neuroma, you have risk of dizziness, and you have to be honest with your employer. And that's hard to hear because people fear for their jobs. But it's also unfair if what you're doing has a risk of endangering others, whether you're have a commercial driver's license. I've had patients who are painters or on ladders. I've had construction workers, and I said to them, you can't do this without touching base with your employer, letting them know, because you don't want to get injured falling off a ladder, things like that. Patients will often ask me how much time off for work. I typically say I think 30 days is a good number. It's probably takes care of the majority of my patients, about 90 days. 90% of my patients. But there's some patients who need 45 days. Some need 60 days. And I don't think that's wrong at all. So just touch base with your physician. Some of my patients at 30 days, they'll just work from home and they'll be on Zoom meetings, and that works for them. And others, I've had nurses, as an example, and being a nurse is really hard work. And I'll say, maybe instead of working a full 8, 10, 12-hour shift, what if you see if you can go back 4 hours a day first, see how you do? Because being fatigued is very common after acoustic neuroma surgery. And as Emily said, the waiting period can be hard. In some ways, mentally exhausting. On the other hand, I've had patients say, okay, I want to make sure I can now adjust my time so my parents can come and watch the kids, so I can make sure financially I'm in a good place. So those are the kinds of things where the open, honest discussion back and forth with both your physicians as well as the peer mentors is helpful. We talked about financial concerns as well earlier. Emily did this amazingly well. I know she kind of criticizes herself. I completely disagree. I think she was one of the easiest patients I've ever had to take care of. And I think you need to give people the tips that you did that made every nurse on the hallway, it seemed like every nurse on the floor was in her room. They'd always stop by. It was always a very warm, hopeful, optimistic room with her and her husband and her kids. So please talk about this.
So it's interesting. Most of us, this is our first journey into being a truly sick or recovering person. So it does feel different. I remember, it feels, we're not always used to having that much attention and questions on how we're feeling, every couple hours, right? Constant questions. So the one thing that I will say is when you are inpatient, in your world, there's only you, one of you, but in all of your caregivers, nurses, there's a lot of you, right? A handful of you at least, depending on what your inpatient setting looks like. So while you are your only patient, you are one of multiple patients for them. So we found, and this is with a lot of the patients that I speak to too, is that the positivity piece it comes out in everything that you're doing, in every aspect of your recovery, leading into your treatment, during your treatment. It's if you can continue the positive narrative in everything you're doing, everything is better. You're healing, your nurses are working with you better. You're being encouraged by your OT, PT, your docs come in and see that everybody's working towards the same goal, and that positivity just continues to go through everything that you're doing while you're inpatient. It's funny, it says in here that you catch more flies with honey. I can give examples. In where I was, we were kind of in pods, if you will, multiple rooms that everyone kind of knew. People would come as visitors, and there was patients that didn't understand the catch more flies with honey and screaming and yelling, and occasionally nurses that would come in and duck in that were in tears. And it just doesn't benefit anybody. It doesn't benefit you. It doesn't benefit the nurse. It's just the positivity, keeping a good attitude the entire time. And it's not easy to do all the time. It really isn't, because you are definitely feeling a little worse for wear in those first couple days. So funny enough, I'm not sure I was the perfect patient, because when PT would come in, I would duck my head and pretend to be sleeping. So I think
You did not tell me that. I was not aware of that.
He is sugarcoating my ability to be an amazing patient, but
Yes, apparently. I thought you were perfect. Day 3 to 5, plan for discharge, all those things, and you'll talk with your individual surgeon. How well are you walking? Are you drinking a lot of water? Very important to stay hydrated. And if you don't have the appetite, I don't think Emily, because of all her dizziness after surgery initially, didn't have the appetite, but make sure you get protein. Same when you go home. You may not feel like eating like you normally do, but make sure that you get the protein, and making sure that you have normal urinary function, bowel function, all the things that make you feel like I'm close to being like my normal self at home. That's incredibly important. And I will tell you, this is, Emily said this well, the nurses, and I've worked with so many amazing nurses in my career, and nurses really make a quality hospital. And especially the nurses that have been doing this with me for a long time, I will listen to them. They can watch the patients well and tell me if they have significant concerns. And having an adversarial relationship with the nurse has never made sense to me, because they are trying hard to take care of you. And I think in the midst of the pandemic, when we had a lot of nurses that were then becoming travelers, a lot of hospitals lost nurses. We lost a lot of experienced nurses. So now the nurses that were left were dealing with more patients. They had more people at a time to take care of. And so the risk of burnout was great. So just remember that you don't understand what it's like to walk in their shoes. They work really hard, long shifts, and thanking your nurses, it just goes an incredibly long way. And I thank them every day for all they do for me and my patients. So this is a book. So I do a lot of culture readings with my team. And this is a book by Stephen Covey's son, Stephen M.R. Covey, about the speed of trust. And it says that trust is the most important thing in relationships, whether it's a husband and wife, parent and child, patient and physician. Constantly communicate with your surgeon and physician. Make sure they're constantly communicating with you. And whether that's through Epic MyChart, email. One of the reasons I give all my patients my email is it's so hard to get a hold of me. I'm in the operating room. I'm in the clinic. My days can get really busy, but by giving patients my email, every one of my patients has access to me directly. Whereas if you call the clinic, you may go through the medical assistant, you may go through a resident, a fellow. So there are many layers, but complications, unfortunately, can occur, and no one likes thinking about that. But I will tell you, as someone who's done this for almost 25 years, how amazing patients are, and letting them know that I'm here with you, that we'll take care of this, we'll deal with this. That goes a long way. And I work hard to teach my residents and fellows about that earn trust with your patients. Make sure that you're always there for them. Treat them like that's your family member. And if you do that, you'll never go wrong as a physician or a surgeon. Emily, you want to talk about this?
Sure. So this is this goes to the positivity portion as well, but what is your why and who am I getting better for? All of us have a why. We want to get back to our regularly scheduled lives, right? This is a bump in the road and it's temporary. We want to get back home to either our kids or our grandkids or our spouse, or we want to get back home and care for our pets, or we want to get back home and finish the book we're writing, doing whatever it is that is our why, that is our passion, and getting back to our healthiest self from prior to when we started having symptoms. I believe that, keeping this positive outlook and helping ourselves mentally in this and getting the help and resources that we need if we can't find that positive outlook, which there is absolutely zero shame in, because this is a big bump in the road. While it is temporary, it is still, it stops us somewhat in our tracks. I mentioned before just how much we have to be grateful for. I have been able to walk alongside patients that have different diagnoses than I did and that most of us do. And if two patients look different sometimes, but the patients with GBM, other types of brain tumors, their diagnosis is very, very different than ours. Their quality of life, their expectancy for life looks a lot different. And it's just a reminder all of the time when I see these patients, how grateful I am that this is what was handed to me and the patients that I get to work with mostly. And that gratitude and giving back to others, for me, not a shameless plug to the ANA, but for me, I think that's kind of why I'm here, is that I love working with the Acoustic Neuroma Association. I love working with the doctors that I'm so grateful for. And it's kind of the whole making lemonade out of lemons. I get to share my story, which hopefully helps somebody else, where they get to share their story with me. I get to hear theirs. And here I am, hundreds of patients into it. And when I finally get to talk to another new one, I say, oh, I talked to somebody that had a very similar story to you. And so I just think that here we are, post-treatment, we're coming around to the end of the journey that we've been on. And I think that the gratitude and just happiness for getting back to where we want to be is the most important part.
I couldn't have said it better. Beautiful. And I think you have given so much back to others. So focus on priorities. This is a slide that I put here because I've had patients, and maybe this comes from some of the support groups on Facebook as an example, or even the local support groups over the years. I have someone with a tumor that's maybe 5 millimeters, and I have someone with a tumor that's 5 centimeters. You can't compare. That's not apples to apples. Yes, both patients have an acoustic neuroma, but they're very different. And we forget we've gotten so much better in treatment of acoustic neuromas in the last 50 plus years, even the last 10 years. I feel like we're understanding the disease better and better. We still have a lot of research to do, a lot of work to do. But I always tell people, don't forget about the priorities. So for example, longevity of life. Thank God, less than 1% of patients who ever has an acoustic neuroma ever has a risk of mortality, a risk of death from it. So that's the number one thing. But on some of these cases, we forget, especially for the surgical cases, if you're a good surgical candidate, if that's what's recommended over observation or wait and scan or over radiation therapy, radiosurgery, there's still risk of stroke. There's still risk of heart attack. There's still risk of postoperative brain fluid leaks, meningitis. So those are the ways I look at it. Longevity of life, avoiding major neurovascular complications, postoperative complications. These things, unfortunately, can still occur even with people who do a lot of acoustic neuroma surgery. Facial nerve function, obviously incredibly important, but as you can see, it's actually fourth on the list. I can't put facial nerve number one and not focus on minimizing stroke risk or meningitis risk or blood clot in the leg, right? A DVT or pulmonary embolus, which is life-threatening. And then hearing preservation. We're getting better in this area. We're doing more and more hearing rehabilitation, concurrent acoustic neuroma surgery with cochlear implantation. So a lot of other things that we're doing, but I think this is a good way to think about in your mind, don't forget to focus on the priorities, because I think there are times when I'll talk to patients and they'll put the cart before the horse. They'll not think of it in a very logical framework, which I understand. It's very emotional to go through this. Who is your community and support system? Emily had this in spades, plethora of support. This is a book from years ago called Bowling Alone. I think the book is almost 25 years ago. And it's fascinating that support system that we've had in America for so long, whether it's your spouse, your kids, maybe it's the Boy Scouts, maybe it's your church, your synagogue, maybe it's the Kiwanis Club, Rotary Club, that we are losing that in the US. And I see it as a physician because I'll have patients who come in alone. Dealing with an acoustic neuroma is hard enough when you have a loving family and a great support system like Emily. But this is brutally hard when you're by yourself. And so I think the ANA, for those of you that don't have the support system, I think the ANA is a great first step, but I don't think it necessarily replaces. I've had patients who've come in with their neighbors. It's really neat to see sometimes neighbors. I had a gentleman who's a widower, and his neighbor kept on bringing him in for appointments. And I thought that was lovely to see. And I think that, it's kind of like a root system, putting your roots into a community. And it's really important. Emily, any other thoughts on this, or Matt, any questions about this?
No, I think you're exactly right. I think, and this is when you have the time prior to treatment where you find out what your support network looks like, and this is part of what you discuss with your providers as well.
I agree.
Now, there's a lot on this slide. I'm not going to read through the whole slide, but this mental health aspect, this is one of the last slides. And a lot of this Emily covered, but mental self-care, exercising regularly, connect with others, getting enough sleep, healthy eating. Matt talked about that. Engaging in activities that they enjoy. It's funny, Emily talked about what's your why? Why do you want to get better, right? I've had parents who say, I want to go home from the hospital and see my kids. I've had patients who are avid golfers and they want to get back on the course. They love being outside, especially in the beautiful summer weather. Those are great. Challenging negative thoughts. I think we all, in the midst of my prostate cancer, I went through that worst case scenario thinking, oh my God, I'm a dad. Am I going to be around? I want to see my daughters as they finish college and get married and have kids. And you start thinking, what if I'm not around? You start going through that. And I think we all go through that part. And having friends and support systems is incredibly important. Practicing gratitude. I'm a big believer of, I've got a gratitude journal that I fill in every day. Take breaks, prioritize self-time, stay present, focus on the present moment. And when you need professional help, I think we have a stigma against mental health. We're okay with someone getting help for their diabetes and their high blood pressure, but we don't want to tell anyone that we're struggling with depression or anxiety. And it's a diagnosis no different than any other diagnosis. So please get help. As the last couple lines say, mental health is just as important as physical health. So it's very important. I think this is the last slide. Some of this, Matt, feel free to ask if these are the main questions you have or any additional questions. I appreciate your time. Thanks, Matt. Thanks, Emily. I hope this really does a good job for acting as a way to help patients go through a process, and hopefully they find it useful before they go to the operating room.
Yeah, Dr. Samy, thank you so much for your time, and Emily as well. You were actually able to answer all the questions that we had kind of through the presentation, and whenever we stopped there a few times. I think it's just important for people to know that every situation is different. There is a lot of different things that we can do, like you said, mentally and physically to prepare and post, and having a community is such a big thing. So we thank you, Dr. Samy and Emily, for taking your time to do this presentation. It's such a big thing in the process. So we thank you for that. Thank you for everything you do for acoustic neuroma patients and for the ANA in general.
Thank you.